happy April Fool's Day. Start with that. But then
Yeah,
also happy Census Day. The Office of Civic
yeah.
Engagement is having like an Instagram live story tonight, and I know they're bringing like a bunch of drummers, and like I heard that you could like even like make it interactive, like you could drum along too, which is pretty exciting. So that'll be fun. And I
And
feel
let
like
me
the census
emphasize
is
the
so
fact
important,
that,
like
yeah.
even in terms of like public health measures, like just like
Hmm.
figuring out like who needs what scenario or like how to like allocate money and
Right. I mean,
no, yeah,
I
you
think
go.
it's important. Yeah, it's important to have the census done, and especially from a student perspective. You sometimes think about it of where do I really belong? But most rules are that
Hmm.
even though you may not be on campus, but you register yourself. This is done every 10 years, and it's a civic engagement come to this, right? It's us being citizens and in essence being counted, right? That's number one. It makes a difference ultimately for the distribution of
Hmm.
representation in Congress. It's distribution of what who is out there. I had our family census just this past week, and what was fun was I engaged my older daughter, who's kind of living at home this year in between graduate school and her undergraduate. So I had everybody in the house do their own little part of it. So it wasn't just me sitting behind a computer. So the three of us did it, and then my younger daughter is
Good.
doing it through Washington University in St. Louis. So yeah, so there's an engagement component, but yeah. So the students out there, really important, take advantage of this. This is once every 10 years, be counted, really critical.
Exactly. And like lots of my friends have asked like where we're supposed to like fill out the census, and someone gave me this advice. It's like where would you most likely wake up like every day of the year or whatever. And like for me that would be like in College Park. So like you should fill out like the
Hmm.
College Park census like if you are like a resident like off campus or whatever, which like I didn't really think about. I just thought like, oh, my parents will fill it out and like it'll be fine, but like really you should do it based off of where you're living for majority of the year, which is really
Right.
cool.
Hmm.
But also like just talking about other like current events, like how are you feeling about like COVID-19 like pandemic now, especially that the US has more confirmed or the most confirmed cases compared to like every other country.
Yeah, it's one of those things where oddly, everything that we thought could potentially happen, right, in these initial weeks of the pandemic being here in the United States is happening. We in the world of public health were worried that, we had multiple problems, including the issue of diagnostic kits and that people weren't being diagnosed. We also
Hmm.
felt that there was a potential that people were out there who were totally asymptomatic, potentially spreading the disease. Now we have some data sort of saying, yeah, that could be happening. And then, the numbers are, take your breath away. Even like in
Hmm.
this last week, I'm looking right now on one of my screens, is the Johns Hopkins Coronavirus Resource Center. So right now, as of, this moment, worldwide, we have 885,000 confirmed cases, right?
Wow.
And here in the United States, we have a little over 190,000 confirmed cases, right? In terms of deaths worldwide, we have over 44,000 people have died from this disease.
Hmm.
In the United States, we have around 4,000 as of this morning. And, it's still, lessons to be learned from this is one, this is serious, this is real, right? We are in that early stage
Yeah.
of, we call it exponential growth, right? It's really, growing rampantly. And part of the issue is that we're in essence, because we've only been just doing these diagnostic testings, at a higher these last few days, that we're just picking up on people who have been sick probably, or who might have been exposed anywhere from 5 to 14 days ago, right? And so this is a catch-up time. But just to our students out there, to our
Hmm.
listeners out there, just brace yourself. These numbers are going to go really, really high at this beginning point. But once again, I emphasize the fact that 80% of the people who get this disease, who have it, the new virus on board, do have relatively mild cases. And so we're still looking at, the crude fatality rate in the United States of a little over 1%. Worldwide, it's around 4%. So it's bad, and it's going to get worse in terms of numbers as we do more and more testing and the disease spreads. But, take care of yourselves and follow those public health recommendations.
Yeah, I think like I've heard from so many people that like it's going to get so much worse before it gets better, and I understand like that's like the trend of how things are going, but it's just like so hard to hear that. Like, just like hearing the future and like hearing like that it's going to get worse, but then it's going to get so much better. It's just like very conflicting to hear.
Yeah, it's one of those things where we keep talking about this curve, right? And the curve keeps increasing. And right now, we look at certainly the hot spots in the United States, as we call them. New York City. Everybody, I'm sure, has been watching the news, and so what we're worried about is that we'll have further hot spots as this disease spreads. You know, best thing to do, and I'll mention this several times during our time together this afternoon, is one, every so often take a break from the data. Certainly to our public health students, I realize this is part of what you're learning. It's good to be sort of on the cutting edge of what's happening out there, but don't get overwhelmed with this right now. And so, take a break every so often. The numbers are going to be out there, and the worldwide spread of this is quite evident. Right now, I think it's 180 different countries are reporting this disease, and this started at the end of December. One single country, right? One single country.
Yeah.
So this is the true pandemic. So take a break from the news, and what can you be doing? The best way of protecting yourself is what we've been saying all along, right? This. Whether the term is social distance, but it's physical distancing, we need to
promoted like the recovery rates and like just different people who have recovered from like COVID, which is like very exciting to see. And someone asked a question, this is actually from Macy Wolf in the iSchool, like if you are immune to COVID, if you were to like beat the virus.
Yeah, so again, brand new virus. We're learning as all this goes. We do have obviously history with similar family of relations of viruses, right? So the coronaviruses, I think, as I mentioned last week, this is number 7 of coronaviruses that we've been dealing with as a human disease. What we've learned from the other ones is in reality that there seems to be at least some sort of immunity right after the disease. And certainly looking at the initial information in these last 3-4 months, 3+ months now of having this disease, COVID-19, out there, the people who have gotten the disease seem to be at least somewhat immune to it for at least, and this is the big unknown, for at least this duration. Right, so at least for the weeks or months after having the disease. What we don't know is how long lasting is that going to be, right? Is this something that's going to be on board as our antibodies are primed to fight this virus? Is it on board just for the next few months? Is it on board for the next few years? Knowing coronaviruses that we've done, and I mentioned that 4 of the coronaviruses do cause are a component of causing the common cold. What we know is that we don't have lifelong immunity to coronaviruses. So the immunity seems to be protective, at least for the short term. We'll have to figure out how much long-term protection we have.
Yeah. And that would be so interesting. Like, this is such like an evolving case, so like it totally makes sense that we don't know that yet. But like also just like with like blood drives and stuff, like seeing like if you were to donate your blood, like if it were to have like antibodies that would like fight off like the coronavirus, that would be like really cool to see. Like hopefully going forward that is the case.
So so related to that, first of all, a key component is there are blood shortages that are out there. So people should not be afraid of donating blood. So that's point number 1. As we mentioned more than once,
Definitely.
we're a Do Good campus. Go out there if you're eligible to donate blood. This isn't something that can be given through another person through blood. We really are only now developing the tests. Once again, I got to remind you, this is a novel virus. We've not seen this before. It was really announced on December 31st, 2019 as a brand new, newly found virus. So we really don't have a well-developed system of measuring the antibodies in our system. Usually the two antibodies we look for are IgM is one category and IgG another category to see whether we have something called convalescent antibodies. But what's interesting with this, and this is the beauty of what's going on in the midst of all this science, is that the idea of using people's blood who have had the disease as treatment for the disease is being conducted right now as trials, if you will. The whole idea that perhaps if I had coronavirus and now my blood has the antibodies, can I take that plasma from me, put it into another person and say, okay, am I going to be able to help you? And those trials are being conducted now worldwide. So it'll be, this is amazing science. And, especially to our students out there, this is the weirdness of all this, right? Is that in the midst of all this crisis, in the midst of all this disruption, right? Science goes on and we have to go in with a certain amount of humility because we're learning all the time.
Yeah, that's so true. I feel like there are so many, I don't know, constant, not even just breakthroughs, but constant ideas that are being tested, and they have to be. And you have to fail 99% of the time to get that 1% that, it actually works. And, people aren't reporting about these breakthroughs, but that doesn't mean that these failures, but that doesn't mean that they're trying constantly and keep trying to do, new things to, help the general public, which is really great. And, also it's just, great for, public health research in general and just health research just to help our society as a whole. But here, we could go into some questions that people are submitting live too, because I don't want to lose these too. But what are the thoughts on those areas of the country who don't have to follow the stay-at-home restrictions?
The reality, right? Coronavirus doesn't understand the borders, doesn't understand borders of our cities, doesn't understand borders of our counties, of our states, and certainly of our nations. So the areas that don't have anything right now, it's not a matter of people saying, oh, we don't have it, therefore we shouldn't be doing anything about this. Really, the recommendations, right, are that, first of all, that nationwide the recommendations are out there, which is stay away from each other, right? The concept of social distancing, the concept of washing your hands, the concept of staying away from others when you're sick, cleaning commonly used surfaces, right? And just good hygiene with coughing and sneezing. All those recommendations are nationwide, be it in an area that's a hot spot right now, or be in an area where there's nothing. I can comment certainly, on sort of the politics of the matter, right? The reality is that governors really are in charge of their states, and certain governors are still waiting to sort of see what's happening before they take the more drastic measures like we've taken here on many states on the East Coast, including Maryland as of, a few days ago. So it's already in all 50 states. So everybody's already involved. And today's hotspot will be a hotspot now. What I'm afraid about is if we don't do these measures, what happens is we have new hotspots developing over the next 2, 3, 4 weeks. And areas that are untouched right now become more touched, right, by this disease. But if we get ahead of the curve, if we do this, even without having disease around us, if we really take this seriously about staying away from others, then those areas hopefully will never suffer the repercussions as we're seeing right now in a place like New York City. So, if our students are somewhere right now and you say, well, the disease isn't here and my governor hasn't said anything, we're citizens of one country, citizens of one planet, and this is a threat against the whole planet right now. So do your part.
You said that this started December 31st, 2019. And so we've had a lot of time to think about this happening, even though it was in China and then it traveled across the world. I'm just curious about how the US could have prevented this current outbreak, for future and upcoming public health professionals. What can we take away from what we're doing right now so that this cannot happen again, or we have a better system in place in the future?
Well, first of all, we really can't control the world that exists around us, right? I
Hmm.
think what this does teach us is that we really are one planet, interconnected, right? With
Hmm.
the animal world, interconnected with people all across the whole planet. So this idea of somehow that, we're different, and somehow we as humans rule this place. So it starts with that. So we won't be able to control this very well,
Hmm.
right? In terms of having new viruses coming aboard. We can certainly look at measures that can be done. This whole idea of the interconnectedness, right, of us and the animal world, right? Do we look at the animal world differently? That's something that's a potential lesson to learn. But in essence, these viruses do what viruses want to do. They want to
Yeah.
be out there and they want to live. What I think we learned a lesson from right now is the reality is that we don't want this ever to happen again. So it starts at the very beginning, right? It starts with us looking at China in December, and the virus was discovered in December, but the illnesses were already probably there in November. So part of it is to make sure that we, in fact, are invested in a very vibrant system of disease surveillance worldwide, that we can basically pick
Hmm.
up on this early on. And then let's never assume, like many countries assumed, oh, this is a Chinese issue, and it's only in one province in China. The minute that we have something that's novel, we should now, from now on, really begin thinking, OMG, right? We got to do something about it, right? And I think that's
Yeah.
the lesson learned. That I hope that our generations now will never get burned like this again. Burned by being lackadaisical, burned by denial, burned by we'll figure out a way. There's a lesson to be learned in this.
Yeah, that's definitely true. I feel like just communication as a whole, like it definitely helps like stopping the spread of like pandemics, but also like these are like this is a virus at the end of the day, and like it's really hard to like stop. Like you can't tell a virus to stop. Like I remember in one of my classes we were talking about like viruses and like infectious diseases have no visas. Like they could go anywhere, and that's like
Correct.
something like really hard to see like in our like connected society.
Mm-hmm.
But also, this is a question from Chidalu Mubanu. She's a public health science student, and she was asking specifically about the US, like why was the US not prepared for this pandemic, even though we did know about this since December 31st, and we like there were so many past predictions and teachings about emergency preparedness by public health experts nationwide.
Yeah, that's something that's going to have to be determined at sort of the highest government levels, right? What we're
Hmm.
already going to know is at the end of all this, when we finally settle the issue, is that there's going to be hearings on Capitol Hill. And in essence, people will be held accountable for reactions or lack of reactions.
Yeah.
I spent 16 years at the Centers for Disease Control and Prevention prior to my, time at coming to University of Maryland School of Public Health. And
Hmm.
in those 16 years, I see an incredible organization. In this case, the question was, were they doing the right thing? I'm not an insider anymore, but the
Hmm.
reality is that we have to be able to analyze what went wrong, because things did go wrong. The whole issue of the diagnostics, that's a major dilemma, right? Because the way you're supposed to be handling this from a public health aspect is you have to have your diagnostics out there early. You have to
Hmm.
be confident that they're going to work. You have to mass produce them. None of this stuff is easy. And so there's always going to be hiccups along the way. But
Hmm.
without diagnostics, you can't, especially with a disease like this, you can't even determine who's sick and who's not. How do you separate? The ideal way of doing this is you have to really diagnose, you have to get the diagnostics out there. And then the people who are positive, you have to really deal with them really aggressively. And that means you take those individuals, you isolate them, you do contact tracing, you look around them. Who did they come in contact with? That's the way you nip something like this in the bud early on. And our
Hmm.
system really sort of just collapsed. We were very passive. Part of it is, from a political aspect, and again, I'm being apolitical here, but the reality was that at the highest levels of the U.S. government, there was to some extent denial that this is a problem. And I'm critical of everyone on this, because there was a sense
Hmm.
that, okay, well, it's not here yet and we have time. Well, come on,
Yeah.
right? This is disease. This is real. And it's, it's going to be fascinating, right, to sort of find out what went wrong here. But right now
Hmm.
for us, it's not the time to start pointing fingers. It really isn't. We have to get to work, right? We have to be able to do what we got to do. And that includes now making sure that there's a vibrant support of everyone out there who's getting the diagnostics, right? It's a potpourri, right? It's government working with private industry, working with scientists, working with clinicians, right, to get the diagnostics out. Next aspect is we have to get really good at treating the really sick people, right? Despite all the shortages, right? And we're going to learn lessons from that as well. We're going to have to be able to, but right now there's other priorities, and the priorities really are is, take care of the individuals who are sick and really work hard to prevent the further spread of this. And that further spread relies on you, Kelly. It relies on me. It relies on everybody who's listening. This is serious stuff. And, sitting at home, yeah, it's kind of a drag, but that's our resolution right now.
Yeah. I know for me personally, like my town has a community forum, and someone commented in the forum that they tested positive, and they like listed like where they've been the past week. And I thought that was so helpful, just like for people to be disclosing that information for like people, like, I don't know, like if you were to just say like you had a fever, you woke up one day with like a dry cough or whatever, you would like understand like, oh, I was in that same place or whatever. And like that's like really like on us to like make sure that we are like telling people that where we've been, like, and accurately like describing like how we like who we've been in contact with. Something that like lots of people have been asking is that like people are confused if someone in your house were to have the coronavirus, like what could you do to stay safe or stay healthy? Like I know for myself personally, like everyone is in my kitchen like 24/7, or people are constantly touching the same like door handles and like surfaces, and like you don't even think twice about it. But like how can we like limit that spread if someone were to have the coronavirus in our own home?
Yeah, and that's going to be happening more and more as these numbers increase. The individuals who have to be hospitalized will be hospitalized, right? And that's
Hmm.
usually based upon how serious the symptoms are, right? A
Yeah.
lot of other people who have the mild disease, right, will either be tested and told you have disease, right, that you have
Hmm.
a positive, and go home and recuperate. And there's going to be a whole slew of people who are just going to have symptoms who may never get tested. So the
Yeah.
reality is, once you have the symptoms and you're living in a house with others, now is the time that you really get, and I'm not going to use this word a lot, but you really get paranoid in that household, which is that
Hmm.
person who is sick really needs to be isolated from others. The 6-foot rule really, really applies. The whole idea that that person perhaps, if at all possible, has their own bathroom, that you take care of that person, bring them their meals, you try to limit their use of the rest of the house or apartment that you're
Hmm.
in. And that then prohibits this whole idea of that person touching solid objects, and you're worried about sort of the contamination, viral contamination of
Hmm.
surfaces. So it really sort of it raises it to a whole nother level, right? The minute that a person has symptoms, the fevers, has the cough, has perhaps the shortness of breath, but also at the same time, you need to be caring for that individual on two realms. One of which
Hmm.
is if the symptoms get worse, right, and specifically the shortness of breath, right, that's the big thing that happens, is people all of a sudden get really short of breath. That's the time to make
Yeah.
sure you take that person to hospital, because you don't want to wait too long on that. Next aspect, you take care of them for not only from the physical side, from the mental health side. It's not like lock yourself in the room and stay away from us, we're afraid of you. It's the ability to
Hmm.
have that interaction, right? Open up the door, talk from a distance, read, listen to music together, right? It's the
Hmm.
whole idea of engaging an individual, that they don't feel like they're just out there as a pariah, but in essence that they're, a part of that home community, and yet have to understand that because of the spread of this, that they need to be separated from others. So let's be caring, let's be working towards curing, and let's be loving towards people.
Hmm. That, yeah, that is, I feel like really important. I feel like most people are very like hyper focused on like just not letting the disease spread and like not getting in contact with someone, but also like these are family members that we really care about, and like we want to make sure like their mental health and like well-being is like also taken like care of, especially during this time when like everyone seems to be just like on edge or very stressed out, like rightfully so.
Yeah.
Someone just like said a comment, how might we ensure that these public health behaviors are not forgotten in the future? And I feel like that's a really interesting point. Like we've been just talking about like, I don't know, washing your hands constantly and like not shaking hands and like coughing into your elbow and whatever. But like, how can we make sure that these are like a part of our lives and like also just like staples that aren't forgotten in the future?
Yeah, it's going to be a reminder to us of how disease is spread, right? And I
Yeah.
think that's an important part of this. In that, two things happen every year. We have a cold season, and we have an influenza, a flu season. Well, guess what? Both these diseases, we think of them as relatively minor. The cold, okay, you get over it. The flu, however, can be a killer. And guess who it tends to kill? It tends to kill older individuals. So it's very similar to the coronavirus. And I think the way we learn about this is that all the lessons learned from coronavirus, let's look at the other coronaviruses that exist out there. These same aspects of being prepared, right? Being separated from others if they're sick need to be applied. And we'll save lives every year from influenza, right? Once again, every year in influenza, if it's a bad season, the press will pick up on it and we'll hear about it. And I'm not talking about, this whole idea of shelter in place for flu season. I'm not going that far. But guess what? When it's flu season and you're sick, stay away from others, right? That applies to the flu. That applies to a cold. You're only spreading disease. Next aspect is this whole idea of our hands being important transmitters of disease. What we learned about washing our hands, let's keep up on that. During that season, maybe the handshake, maybe the close contact isn't always necessary. So I think it's a reminder for us to basically look at not just COVID-19 as a beginning and an end, right? That somehow it's all over and we'll just go back to our old ways. But what we need to learn about is disease spread and how it affects our society in general.
So true. I think for me, at least, this sounds very minor, but like for hand washing in general, in my microbiome class, actually at the University of Maryland, we did we put our thumbprint on a petri dish and then we washed our hands and then put our thumbprint like on the same petri dish and we like let it incubate for like a day, I think. And the first thumbprint was disgusting and it had so much like growth on it and everything. It was disgusting. And then the second thumbprint was spotless and completely clean. And I feel like that's just like something like if you see that once, like you will always like wash your hands for the full 20 seconds, like, happy birthday twice. And that's just something that we definitely have to keep bringing forward. But yeah, I think that's really important to say, like, also like the flu season and the cold season, like are still around, like even though it's not an infectious disease and not super flashy in media, like we still do need to be like cognizant of what our actions are and like how we can prevent those illnesses from happening. Some other questions that people were talking about, just talking about masks again, do you think like the guidance around masks for the general public will change, or do you think it should change in the future?
Well, once again, things are changing all the time with brand new information. So the mask issue seems to be evolving right before our very eyes, right? So we went from even the public health people saying, okay, don't use masks, right? Unless what? Unless you're sick, right? Okay, if you're the one who's sick and you don't want to spread it to others, that's one way of putting that barrier in front of you. And then obviously we're trying in the midst of shortages to retain the N95 masks and surgical masks for healthcare professionals because there's a shortage. So don't do a run on masks. Two things happened in this last week. One is that the CDC, right, has come up with guidance talking with healthcare professionals and basically saying, okay, remember the rules we had before? Well, I'll tell you, they're not happy about this, but, well, it's, I guess, better than nothing, right? Which is, okay, remember the rules about the N95 and their single use, take them off? Well, now we're looking at ways to try to retain them. Can we disinfect them? Okay. I spent 16 years working at the CDC, specifically in the occupational health realm, right? And for me as an occupational health person, it's like, that's unbelievable to see you're going to be cleaning N95s, but these are extraordinary circumstances. Now, for the general population, what we seem to be getting to, right, and back to that guidance from the CDC, they actually then, for that guidance, said, well, healthcare professionals, if you have nothing, the bandana around your face is not, right, recommended, but it's better than nothing.
Yeah.
Okay, once again, as a public health guy, I don't like that, but okay, maybe. Now we're
Hmm.
gotten into a whole new realm. And the whole new realm now is, we were always saying for the general population, stay away from masks, right? Now it seems in the last 24 hours, several things are coming up. The CDC director yesterday basically said is up to 25% of individuals who are carrying the virus may be totally asymptomatic. So
Yeah.
guess what? You are healthy right now, Kelly. I'm healthy right now. Well, if there's four of us, chances are one of us is actually carrying the disease. So now I can't just
Yeah.
say, if you're sick, put it on. Now they're beginning to think as well, maybe if we're getting outside and we're potentially in
Hmm.
contact with others, that, even though they're 6 feet away, let's be extra careful and look at the mask issue. Once again, what I'm telling our listeners here today is, don't go out there and try to find N95s, right? The guidance
Hmm.
will probably be out in the next 24 hours from CDC. It's looking at even the world of making your own masks, believe it or not, in the time of shortage. That's
Yeah.
my daughter who likes sewing is looking, and there's multiple, websites now talking about
Hmm.
making your own mask. So we're actually transitioning right now, right, in terms of public health recommendations. So get ready for this idea that there may be a next movement on that, where basically says is, everybody should get a mask, make a mask, or do something, right? Wear a shawl around your face. Maybe that'll help the spread of this disease.
That's so interesting. And speaking about like other CDC like recommendations and guidances, like just talking about social distancing, perhaps, like would it be enough technically to stop the virus, or are we just buying time by social distancing to like develop an antiviral or a vaccine for
We're
COVID-19?
doing two things, right? The social distancing
Hmm.
really is doing two things. One of which is, and this is a term that was used 2-3 weeks ago for the first time, and it's basically called flattening the curve, right? So the whole
Hmm.
idea is, if we social distance, we're not going to have that supreme peak, right? And that then overwhelms the medical care system. So we spread it out a little bit, which is the ideal way of doing things like this. So social
Hmm.
distancing is helpful for that, from that aspect. The next
Hmm.
part of this is social distancing. So it goes back to this thing, and I might have mentioned this on last week's Kelly Sherman show, is
Yeah, no.
the idea that if we all did this right. So this is a virus that only lives in humans right now.
Hmm.
And it's only spread from human to human through this aerorespiratory route.
Hmm.
So if for the next 2 or 3 weeks, all of us, aspirational, but the whole planet basically said, we're following this rule, and all the people with the disease are being isolated, and the seriously ill people are in hospitals being taken care of,
Hmm.
this thing can actually theoretically stop in 2 or 3 weeks, totally, right? If we did this right. Because we're not doing this right, and because we have all these unknowns, it continues to spread. So the social distancing is almost the sense that that's our answer at this point in time. Yes, it buys us a little bit more time for potential therapies that are being
Hmm.
investigated out there. Again, multiple clinical trials are going on. So thus far, we've not found the wonder drug. It's being looked at. And the chances are we really won't find the wonder drug. And the same thing from the vaccine perspective. It buys us a little bit more time, but pretty much we're a long time away from getting a vaccine to this, if in fact we're successful actually doing it. So in the meantime, we go back to these public health measures that are well known since we began understanding infectious diseases, right? Stay away, find out the route of transmission, and stay away from others.
Hmm. I think lots of like students and like faculty members are like just like curious about different personnel that might still be on campus and stuff, and just like I know like I'm like just like worrying about their safety, and then also just like them being parts of families, like going home to like their children or whatever, like after like being in like a hard like environment or something. Like how do you know how UMD is protecting like our hourly employees at this time? Like I'm just like worried about custodians, and that's what somebody else also said on the SPH Instagram. They DM'd it.
Right. Yeah, and so we're really sort of, basically the attitude at UMD College Park is this: for individuals who can work from home, who can telework, are now basically being told you have to telework, right? So we've
Yeah.
actually transitioned with Governor Hogan's, sense a few days ago of basically saying saying that we should shelter in place, right? And so anyone who telework should be teleworking, so they should not be on campus. For people who are not essential to the functioning of campus, and now we're really talking about relatively small numbers of individuals who have to be there to take care of, for example, the animals that may be on the animal world out on campus, or taking care of the infrastructure, making sure that the buildings don't freeze over or get too hot, and the custodians who need to still come by and clean up, although that even now is a skeleton crew to a large extent because the buildings aren't being used, but we still need to do that. So for those individuals who are essential, they're of course still working, but they're following the exact same guidance we were following a few weeks ago, which is stay away from each other, right? We're making sure that the workloads are such that you're not within 6 feet of each other, and you're following all the other aspects, and that you're washing your hands constantly, and that you're disinfecting surfaces if you're touching them. There's also another group of individuals who are a lot of our hourly staff who are important to the functioning of our university. They're our friends, they're our neighbors. They make sure that we eat well, that that we're doing fine on campus. A lot of these individuals who aren't deemed essential and still can't necessarily telework, right? If you're a custodian, it's difficult to say, okay, I can do that from home. Those individuals are now on administrative leave and are being paid, right? And so the idea is that I think the university has come up with this compassion component, which I think is important that the students know about, right? Is that make sure that people are being taken care of, and we're trying to minimize the number of people on campus. The only other group that I haven't mentioned that's on campus are only essential level researchers. And so we, for example, have at the School of Public Health a world-famous researcher, Don Milton, who does work on influenza virus, and now is working on coronavirus. So his lab, because of its importance for us to get information, is still functioning. So what are we doing there? Well, his lab is a separate part of the building. It's only being used at that point. Only his team has access to that. In the lab, they're keeping 6 feet away from each other. They're washing. They're making sure that they understand this virus more so than anybody else. So building access university-wide is really now limited to only people who have the key card that actually allows them to come in. So I'll tell you, I'm the dean of the School of Public Health. If I tried to get in today, chances are I couldn't. I'd be locked out because I'm not deemed essential, right?
Yeah.
So that's how we're trying to protect people, is stay away from the workplace, stay at home, follow the rules.
Wow. That's really crazy that you couldn't get in. But I kind of like that you can't get in if you're not essential. That's how it should be.
Right.
Some people are asking questions in the comments, like, what's the best example or metaphor for the coronavirus? In a White House briefing, they used AIDS, but the transmission is completely different. So I was just wondering if you would compare it to anything. I know this is a novel virus, but what would you compare it to?
In our lifetimes, the best we can compare it to is probably nothing. We had a pandemic influenza in 2009, 2010. It followed, influenza sort of, a pattern that we've seen with those viral outbreaks, but it was actually relatively mild. It still sickened 60 million Americans, but only about 12,500 ended up dying from that. So it was a relative non-killer. So we'd actually have to go back to, the metaphor would be one that very few people, really experienced, right? And they're very elderly right now, and that's the 1918, 1919 influenza that was incorrectly termed the Spanish flu, the Spanish influenza. I like to call it the 1918 influenza. And that one was kind of similar to what we're seeing now. Now, mind you, it was 100 years ago. Science was different. Our understanding was different. We couldn't even see that virus underneath a microscope because the microscopes weren't powerful enough.
Yeah.
So, as I mentioned last week, the beauty of having a 1918-like flu in 2020 is that we're actually better than we've ever been before, and actually more prepared for this than we've
Hmm.
ever been before, despite all the drawbacks to the site. So the optimist in me says, okay, yeah, this has really kind of slammed us hard, right? This
Yeah.
is, this has hit us from nowhere. We knew, as a public health person who served many years in the government, that someday this was going to happen, right? We
Hmm.
used to call it disease X in our planning, and disease X kind of had this pattern. It was going to be airborne, person to person spread. That's what always scares us. That's an easy way
Hmm.
to spread
Exactly.
things.
Yeah.
And that it was ultimately going to go through the planet, and it was going to tax our system. So, disease X is
That's,
here, and we happen to call it coronavirus.
hmm That, yeah, wow, that is so true. And I think it's really great to be optimistic in this time. Like we've had so many, like, just like different explorations with like even the microscope, like you said, like we have so many technological advances, but also we should be relying on like the same things that worked 100 years ago.
Hmm.
Um, but talking about just like different like technology things and drugs in general, this is a question from Kelly Rourke, and it's about the hydroxychloroquine shortage and what the state of Maryland is doing to ensure like prescribing is being done in a responsible manner.
Well, hydroxychloroquine and chloroquine, two drugs that have been used for 40, 50 years. So these aren't brand new
Hmm.
novel drugs. They're used for a variety of diseases. Um, and they're actually necessary for people with the diseases that they're already used to treat, real
Hmm.
bad arthritis, for example, malaria, right? Other sort of autoimmune diseases can be treated with this. So the unfortunate thing is that I still, as a physician, right, I'm worried about the patients out there who need this drug for their diseases, right? So the run on the bank again here of people trying to get prescriptions for this is not the right
Hmm.
approach, right? Because people who desperately need this are now getting this taken away from them by people who are trying something. So, clinical trials are ongoing with this.
Hmm.
It's been mentioned not just as individuals, whether it's hydroxychloroquine or chloroquine, but it's been talked about of using this in conjunction with other medications, including an antibiotic.
Hmm.
Um, and I would just wait. I wouldn't tell anybody, to go out there and get these medicines and give it a try. That's not the answer. The answer
Yeah.
is right now, the clinical studies are going on. If this is going to be helpful, then we're going to find out through science that this is something that needs. Right now, there's too many of these options out there that people are saying, oh, this is the wonder drug, this is the wonder drug, right? Right now, the wonder drug, staying away from each other. That's the wonder drug. That's what's going to work, right? For
Yeah.
individuals who are really sick, right, in the hospitals, that's where the clinical trials are ongoing. So in essence, in desperation, right, the doctors, the nurses, the healthcare providers out there, all those incredible heroes working in the medical care system right now,
Hmm.
under the right circumstances, are now testing all sorts of these regimens to see how they can save lives. And that's what they should be used for.
Gotcha. And like lots of like students have to take this drug as well. And like what should students do like if they have to go to classes without their medication and like they're unable to function but still trying to get through like say benchmarks for public health or something?
Well, once again, I would make sure that those students who may be already on hydroxychloroquine for other reasons, make sure you contact your healthcare provider and
Hmm.
tell them where you're at, in terms of how much you have left. It again teaches us to be prepared for these things. And one of the things
Hmm.
we always should be prepared for is making sure that we have the pharmaceutical products that we take on the here going to be a run on the bank on hydroxychloroquine. So turn to your healthcare provider, seek advice of
Hmm.
where you can find sort of this medication.
Okay, good. And then like just going off of like I'd say like healthcare providers and just like the healthcare industry and how it's been changing so much like constantly. Like I know from my provider at home, I got an email saying like if you feel sick or have like if you have a fever, then you should call in to like your checkup or whatever, like if it's non-essential, and like just talking about like telehealth and everything. And one student at the School of Public Health, Sandhya, asked, do you think like the expansion of telehealth will continue and be supported past this pandemic? Like, do you think it's like a very like valued option to have instead of like direct patient care like in front of someone, or what is
I
your
think
perspective?
we're learning as we go. I mean, telehealth
Yeah.
is already beginning to be used in certain circumstances. You know, for example, in rural areas where people didn't have access to some of the specialists. Even the whole idea of behavioral health, telepsychiatry, teledermatology, where you can sort of
Hmm.
say, here's my skin rash, what do you think? So it was already in its infancy, I would say. I think we're learning a whole lot right now in terms of saying, you know, will the medical care system evolve into using these technologies? And I think the answer is going to be yes. I think people are going to find that this is part of the first 21st century way of doing things, right?
Hmm.
You know, it saves us time, it saves us effort, it saves us money, it saves us, you know, air pollution from driving, right? It's this whole idea that from in the midst of this crisis, we're going to learn about whole new approaches. And much like your question says, are we going to learn about public health and what we should be doing with other diseases? My hope is that
Hmm.
that information is retained. Will people learn that getting the flu vaccine every year is important? I hope people learn that. Otherwise, you know, we lost an opportunity here. And will medicine change in terms of its approach? Absolutely. You know, what your doctor told you was the right answer, which is, listen, my waiting room may or may not even be open anymore, right? Because
Yeah.
that's a place of a social gathering, right? I can't have people sit next to each other in there. So therefore, give me a call. Let's talk over the phone. And guess what? Ultimately, if it's really serious, then you need to have it taken care of. And that's where you go
Hmm.
into the hospital.
Yeah. That does sound really cool. I know some students at the School of Public Health actually are working on like a chatbot, like you know Viral Shah, like he and his team are working on this chatbot called Chat Health, where it's like run by public health volunteers, where you could just like talk to people, like not like a doctor or anything, but just answering like common questions about the coronavirus, which I think is supposed to launch today, which is really cool. But then also, someone just wrote a comment saying, is there a way that public health students can contribute in any way to this?
Yeah, I think, you know, one of the things I think that's important is that we're certainly beginning the various endeavors at the School of Public Health. So my principal
Hmm.
associate dean, Dr. Dushanka Kleiman, is beginning to work with our faculty in terms of volunteerism at various levels, right? We're already reaching out and have worked with the Prince George's County Health Department, with local health departments, specifically Montgomery County as well, and with the state of Maryland Department of Health.
Hmm.
There's also an ability for our students to volunteer, and those in Maryland specifically, is Maryland has a site that talks about a medical reserve corps. And it's not just for medical people, but it's a way where you can sign up and just tell them that you're a public health student or that you're a student
Hmm.
at the University of Maryland and are willing to help, right? It's an online form to fill out. It's you know, it's a little bit of information, but you ultimately get put on a list of individuals that, if the need comes, and again, medical experience is not necessary, right? If somebody needs to help direct traffic at a testing site, that
Hmm.
may be what you're doing, but it's the Maryland Volunteer Medical Corps, right? And that's critical. If you're at other states right now, go online and see if your state is doing something very similar, right? Sometimes it's
Hmm.
called the Medical Reserve Corps. Sometimes it's called just, you know, volunteer, right? But right now is a good time. I understand all of you are experiencing a brand new thing with online courses, and that's a hassle, and nobody likes it, but that's what we got. And we want to continue
Yeah.
the education process. But at the same time, if you want to be part of the response, look at volunteer opportunities that are going on locally.
Yeah, I didn't even know that was a website. That is so cool to like be able to do that. I know a few of my friends went to Baltimore a few weeks or a few days ago. It's been a long week, but they went to Baltimore a few days ago and they helped with like making different masks at like a facility, and it definitely was probably like through something like this, which I thought is just like really cool. And then just like going back to UMD and like SPH specifically, we have a question from a girl named Lola, and she was wondering, will like the School of Public Health be offering like a crisis fund for students, like particularly
I
for
think
the School of
right.
Public Health?
Right. I think right now we're looking at, putting in our funds into the university-wide crisis fund. But let me check into that, whether we're going to be establishing something. I know that what we oftentimes do as a school is we contribute from our funds to sort of the general university needs, and we all the deans work on this together. Let me check on whether there's going to be an option for just looking at a crisis fund within our own school.
Mm-hmm. Awesome. And then, like, also, it's like a really, like, I'd say hard time for like everyone in general, but also like people who are upperclassmen and thinking of like applying to master's schools and like graduate schools. Like one question that someone asked was, can we still like apply remotely for master's programs during this pandemic?
Yeah, I think you should be able to do that. We've all gone to various levels of looking at not only the students that have been admitted, right? This whole idea of new student or accepted student weekends are all gone. So we've gone online with that. I think a lot of schools are now sort of putting off some of their deadlines for applications to graduate schools. So check with your specific school. But a lot of this is going to be held in a very different manner than it did before, at least for the next few months. And in reality, I think what we have to be able to do is be prepared, much like we've already done at the university, right? We initially said, okay, we're going to do this for a few weeks. We've now extended it for the whole semester. I think psychologically, we all should be thinking that, June is the time period of where we may see a turnaround, right? And people go, oh, no, he just said June. Well, first of all, don't hold me to it, right? Don't hold me to it. If we do this right, maybe it'll be earlier. It's certainly not going to be Easter, right? We know that, right? And chances are we're going to be spending a little bit of time through May still dealing with this. But, a lot of unknowns, a lot of sense of whether we're going to see a single wave of this, a double wave. But I would at least the way I'm handling this is saying, okay, June is really the time that, we're going to start changing things, right? That we're going to go back to some sense of normalcy. Right? If it happens earlier, hey, that's great. It may happen later, in which case it's even a further drag. But we're in this for the next few months.
Yeah, I know. Like specifically for the School of Public Health at Maryland, we have like an online perspective, like students like question and answer session at noon tomorrow, which is great. But then also like for every other school that you're applying to, you have to like check in with that website as well.
Right.
And yeah, so also like just like talking about how like this is like a really unusual time and like there's so much uncertainty. Like I was wondering, like Dean Lushniak, if you could like acknowledge like how you feel about everything that's going on. Kind of like your 30-second thing that you put me on the spot to just talk about COVID-19. But what are you thinking right now?
Well, this is a remarkable time. I mean, it's, first of all, with full sympathy and empathy, right? We know people who, we know right now our numbers even at the University of Maryland, although that's probably not fully covered. We have 13 students that we know, or actually 11 students and 3 faculty, staff people who have been diagnosed with disease. We're all going to know somebody with the disease if we already don't. So my first reaction to this is I want this over as soon as possible because I'm a physician, I'm a public health person. I want suffering or potential suffering to stop. So my initial thing is I'm angry. I'm angry that coronavirus, came aboard. I'm angry that we have to deal with this. I'm angry that I'm sitting at home instead of in my office at school. I'm angry that you, the students, are being given a different route of your education for this semester. So that's my first reaction, is utter anger. And then to some extent, I then kick back and say, well, as a public health person, as I already told you, we've been planning for this for a long time. And what it shows me is that, and the acknowledgement that, we've been screwing up, right? The whole world's been screwing up in this one. Let's learn lessons from this, and let's get better at this. And it is that respect for us as a planet, right? If you didn't believe the concept of one health, that this planet is now interconnected with the health of humans, directly with the health of the animal population, and the animal population and us rely on the health of the earth itself, of our environment, of our ecology, right? Then what we shall be inspired with is saying that not that, a full understanding and a full recognition is going to solve problems like this in the future, but it at least allows us to understand where we fit in. And we're but a partner on this planet. And so I walk away sort of philosophical about this. So I start with anger, and then I'm kind of like, how cool this is that we're living through this as a public health person and that we can begin sort of doing something about it. So it goes from anger to saying, okay, it's here, let's do something about it, let's use our science, our knowledge, our arts, our humanities, and let's figure out how we care for each other. And then the last aspect is, boy, let's learn a lesson from this.
Lushniak, like what are some coping methods or like things that you've been doing, like even when you're angry or like stressed out during this situation?
So I've tried to use it, it's my wife and two daughters home together. And I kind of look at this as kind of a special time because for a while there with two kids away at college, we were empty nesters and now everybody's home. So everybody's busy throughout the day, right? And yet we're trying to make some quality family time, right? So what are we doing? We're talking more than we've ever talked before, right?
Yeah.
We're still following the rules that Governor Hogan gave us, but one of those rules is you can take walks as long as you're separated by 6 feet. My favorite thing to do is I live in Rockville, Maryland area, and nearby is this network of trails that go into the forest. I'm really a nature person. And it just so happens that for the 4th or 5th year in a row, nearby is an eagle's nest. And the little baby eagles were just born a few weeks ago. And so we tend to, on a daily basis, head over there, right? The four of us, and bring a pair of binoculars. And it's kind of cool to kind of sit there in the forest, right? Gaze through, trying to, at this point, just see the baby eagles from afar. Mama or daddy eagle is always hanging around there, obviously. And it kind of centers you, right? You get away from it. We've played games, and guess what? One of the games that we've been playing that we haven't touched in years is the game Pandemic. I'm not, getting any money from them or anything, but it's, it's a way to engage in this, kind of in this pathway of trying to solve disease. Right, playing different roles, and it's a team game, and you're sort of up against diseases there. So, we kind of use that to learn a little bit about it. I'm, reading the paper. I'm spending a little too much time on, following the news. I'm trying to back away from that, and of course, I'm working nonstop and talking a lot with the press. So that's been, it's been a fun part of things because, my goal is to get, the right news out. So I think that's important.
Definitely. I think the cool thing like about this is like you have to just be like very creative. I feel like some of my friends, we had like a Zoom call the other day and we played this game Psych, which is by like it's like Heads Up, but it's like by Ellen, and it's just like kind of like Cards Against Humanity, but like you write in like different things, which is a lot of fun, and we've been able to play that like through Zoom, which is awesome. And I feel like it's just like a good way to stay connected with like different people, like even if you're so far away, you're still cracking up at the same things, and just like having like those moments where you're still cracking up with the same people, like it's really exciting. But then also like I feel like it's like really cool just like to have these like, I don't know, like few moments of like bliss like in a very like stressful time. And there are so many like healthcare heroes like within our society today, even like just people who are staying home, like you're being a hero by staying home. But also just like in like healthcare, like whether it's the nurses, the doctors, PAs, volunteers, and like so many more, like what is something like you would say to like encourage these heroes, or like what should we be saying to these heroes?
Well, much like they've been telling us, is that, we need to stay home for them to do their work, right? And our support of them is that we don't end up being a patient on their wards, right? I know there's groups have been out there. I think somebody wrote in a while ago how, volunteers in their neighborhood or at their, are making masks, finding how to make masks and giving them to the local hospitals. Right now, I think the key is, volunteer where you can, and show your love and respect for the people on the front lines of medical care by following the rules, right? And avoid getting sick. That's I think, the best level of support.
That is awesome. Yeah, thank you. And then are there any more questions or any thoughts that people might have who are watching this video now? I don't want to take up your time. If you have questions and you want them answered, definitely send them in. But yeah, I feel like it's really important. I've seen so many things on social media where nurses and doctors are holding up thanks for staying home, so we can do our job better. And
right.
It's just very powerful to see that. And yeah, so it looks like no one's sending in any more questions. But if there are any more questions that people have after this video or anything, feel free to DM the Instagram for the School of Public Health, or email the comms from the School of Public Health, and hopefully we can get them answered or put them on the website so that you could see them soon. And thank you so much, Dean Lushniak, for taking the time out of your day. And I was just wondering if you had any last encouraging words for us.
Well, study hard, right? I mean, you're still students in all this.
Yeah.
And so, this will be part of the narrative of the rest of your lives, right? Mm-hmm. People will, right now it's hard to see the forest from the trees, but learn, right? Not only learn what you need to do to thrive in this semester, but learn about life, learn about public health from whatever angle you want to look at. Really need to kind of look at this as, not the best of circumstances, but it is an opportunity for us to look at the world very differently.
That is very true. Yeah, I feel like it comes down a lot to perspective within this and just understanding different things that are happening. Oh, someone sent a question too. If you were to carry the virus and have no symptoms, do you still have, are you still carrying the virus after 14 days?
Yeah, it's a really good question. And right now, I think for the most part, we're still following the 14-day rule, right? Which is in essence based upon some scientific information that came out of China. What's perturbing a little bit is the fact that people may still have the virus in them, but if they've, never been sick, the question is, do they have enough of a viral load after 14 days to actually, spread it? And so that question is fraught with danger for me to be able to say definitively no, because we're just learning right now about the asymptomatic carriers, right? What we knew beforehand was that if a person did get the illness and had symptoms, that, it'd be roughly 14 to 2 to 3 weeks before one recuperated. But what we had in many cases there was a test was redone on those individuals. And what we were looking for in the initial stages of this was 2 negative tests 24 to 48 hours apart. And so we had definitive ways of measuring whether you still had the virus on board. I don't have the data on the asymptomatic people because nobody's been really studying them. And so right now, it's an uncertain thing, right? So that's why no matter what, if you think you've had the disease and you're no longer having symptoms, the rules still stand for you, 6 feet away from others until we get a better understanding of this whole new novel virus.
Sounds good. Someone commented, is the dean keeping a journal? I think you should write a book. Honestly, you've lived through so many, interesting public health experiences. And then also you're just so optimistic. I feel like that would be very valuable for lots of students, going into the career field. And then also just in general, I think it would be very interesting.
Well, thanks.
But,
it is interesting that, as I mentioned last week, in my public health career, which is now, 30 plus years in public health, every so often you get hit with something that you basically say is, oh my God, we're here, we have to do something about this. Yeah, keeping a journal is the thoughts that are out there are important. I wish everybody keeps a journal about what we're learning about ourselves on this, right? You never, there's a saying about, always take advantage or never lose the sense of taking advantage of a crisis, right? And the opposite is not what you want to do. You don't want to say, oh, we're in a crisis mode, I'm shutting down, and I'm just going to be fearful, and I'm going to back away, and I'm going to change my life. Nobody asked for this. Nobody wanted this. But let's learn, right, about ourselves, about humanity, about our neighbors, about our family members. Let's learn about society, right? And let's get better.
Yeah, that is very great. Way to take a dark situation and bring it into a light way. That's awesome. Thank you so much for Dean Lushniak joining me today. And I just really appreciate your expertise and your knowledge about everything that's happening, and just like a great way to still be empathetic and like real with students and just like our campus community. I feel like that's really important, especially during this time, because there is a lot of uncertainty, and we need like leaders that are telling the truth and also like having that human aspect so we can all get through this together. And we are so much stronger of a campus community having these conversations, even if they're uncomfortable or we don't know all the answers. It's still good to address them in some light. But thank you so much for your time.
Great.
And thank you everyone who tuned in and submitted questions. Like if you have any more questions, definitely like submit them or DM this account, and like we could hopefully address them in the future.
Absolutely, and thanks. Great job, Kelly.
Yeah, of course. See you guys.
Okay.
Stay healthy.
See ya. Bye-bye, everyone.
Bye.